Exactly. It's the most contagious virus we know. Yes, it can linger in the air. Even after an infected person leaves the room, it can be there for 2 hours.
New this morning, March is Kidney Disease Awareness Month. And could ultra-processed foods be derailing your health journey? Plus, the measles outbreak is getting worse. Dr. Frita Fisher's here with your health headlines this Saturday. So good to see you.
Good to see you.
So let's dig in. Let's start with the measles. It's spreading. How is it spreading?
It's spreading miraculously. We have over 259 cases in Texas. In the United States, we have over 300 cases. So already in March, it's not even St. Patrick's Day, but we have more cases this year than we had in all of 2024. And the issue is that most of the people who get the measles are unvaccinated. If you are unvaccinated and you're exposed to someone with measles, you have a 9 out of 10 chance of getting it. And so now we've had a real decrease in the number of people being vaccinated. We even had our first death by the young boy in Texas, first death from measles that we've had in a decade. There is something we can do about it, but right now, even our young people, our newborns are getting it because you don't get the measles vaccine until you're 1 year old. And so if you're exposed to people with measles, then you're really vulnerable.
And let's talk about how contagious this is. I mean, it can be in the air, right, for like 2 hours.
Exactly. It's the most contagious virus we know. Yes, it can linger in the air. Even after an infected person leaves the room, it can be there for 2 hours. And it's not just a matter of getting a rash. You can get runny nose, you can get fever, red eyes, but complications from measles include encephalitis or brain inflammation, pneumonia, you can get hearing loss, and certainly you can get death. So right now we're having a very high measles outbreak, and unless more people get vaccinated, it's going to continue to grow.
All right, let's move on to ultra-processed foods. We're reading the headlines, we're hearing it on social media. What are they?
Ultra-processed foods are foods that are high in salt, high in added sugar, high in calories, low in fiber, and they have chemicals that you won't find in your grandmama's garden. It's all kinds of unnatural foods, unnatural chemicals. The issue is this: if you have a diet high in ultra-processed foods, it increases your risk from dying of cardiovascular disease like heart disease or strokes by 50%, increases your risk for obesity by 55%, diabetes by 40%. I can go on. The big problem, Caitlin, is that in the United States diet, over 70% of our foods are ultra-processed foods. In our children and teens, their diets consist of over 2/3 ultra-processed foods. So there are things that we can do, certainly. We can do diet swaps, but ultra-processed foods, it's documented. We've had large studies, huge studies that cover over 10 million people. We know that ultra-processed foods cause early death. And so in the United States, we've got to get things moving.
For sure. And what I hate, too, is that those ultra-processed foods tend to be cheaper and more affordable.
Absolutely. Because the simple solution, it seems, is to cook your food at home, get whole foods, but those foods are not affordable. The chips are affordable. The hot dogs, those things are affordable. And so we really have to figure out a way for everyone to be able to have whole, healthy foods and still be able to pay the bills.
100%. So March is Kidney Disease Awareness Month. This is your specialty. This is your thing. Okay, so what are some ways to protect your kidneys before you get down the pike and it's way too late?
All right. So the first thing, get regular checkups. You don't want to wait until you get symptoms. You want to see your doctor because when you go for those routine histories and physicals, they are screening you for kidney disease. Over 35 million Americans have kidney disease and most do not know it. And so yes, I'm a board certified kidney doctor. So a lot of times when I meet patients, I'm shocking them when I tell them they have kidney disease. So get preventive checkups, and the top 2 causes of kidney failure are diabetes and high blood pressure, so you want to maintain good blood sugars, maintain good blood pressure. Drink lots of water. Dehydration can lead to kidney failure where you need dialysis. Avoid certain medications that can harm kidneys, like certain NSAIDs, non-steroidal anti-inflammatory drugs, like ibuprofen. I'm not saying absolutely, that these are demonized medicines, but make sure you know your numbers and know what to avoid. You want to exercise, and guess what? Reduce stress. Stress causes...
imagine that.
Easier said than done. But yeah, stress causes an increase in stress hormones like cortisol that tightens blood vessels, and that can lead to kidney failure. So yes, it's Kidney Disease Awareness Month, so make sure you make yourself aware. Check different websites. Certainly with me, drfrita.com, I give kidney information all year round.
Is there any specific test that you have to ask for, or do you guys automatically test kidney health?
We automatically do it, but ask your doctor about your BUN, creatinine,
Okay.
and EGFR. Even if the doctor says, okay, everything looks good, everything's fine, stop them and say, okay, great. What is my kidney function? Do I have a stage of CKD? Be specific, advocate for yourself, and let your doctors know that you are aware of kidney disease and that you're trying to prevent it.
And, you know, celebrities normalizing kidney health. Dwayne Wade, for example, recently opening up about something very personal. What was that all about?
I love that he shared it. So Dwayne Wade, we know he's a wonderful basketball player and icon, the picture of health. Well, he shared that he was diagnosed with kidney cancer. His symptoms included abdominal pain. He had a change in the way that he made urine. Fortunately, he listened to his body. He got checked out. He was able to remove the kidney cancer, have it removed surgically, and his prognosis is very, very good at this point. The important thing is that no matter how healthy you are, if you have abnormal things happening, so for kidney cancer, it might be blood in the urine,
Sure.
abnormal urine flow, and you just go get imaging studies, be honest with yourself, honest with your doctor, and it's something that can be treated, thankfully.
Always so knowledgeable. Thank you so much for sharing with us, Dr. Frita. So great to see you. Happy St. Patrick's Day. We are ready.
Yes.
And Alex is ready for whatever is coming tonight.